Welcome back. This is Brilliant East. Here's my girlfriend. Video number 5. Amazing. Question number 41. You receive a 74-year-old woman with a history of diabetes brought to the emergency department with altered mental status. Her home health aide states that the patient then ran out of medication 4 days ago. Her blood pressure is 130/85 mm mercury. Her heart rate is 110 beats per minute, respiratory rate 18 beats per minute, and temperature is 27.6 degrees centigrade. On examination, she cannot follow commands but responds to stimuli. Laboratory results reveal white blood cell count of 14,000 per liter has increased, hematocrit 49%, platelets 325 per liter, sodium 128 has reduced normal, potassium 3 normal, chloride 95, bicarbonate 22 equivalent per liter, blood urea nitrogen of 40 mg per deciliter, creatinine 1.8 mg per deciliter, and the glucose has shot to 55.6 millimole per liter. Urinalysis shows glucose of positive 3, protein positive 1, and no blood or ketone. After addressing the ABCs, which of the following is the most appropriate next step in management? The answer is A. Administer 2 to 3 liter bottles of normal saline followed by IV insulin, because this patient, as you can see, the patient is more likely to have hyperosmolar, hyperglycemic, non-ketonic state, and the glucose has raised, but the ketones, there's no ketone in the urine. And yeah. Question number 42. A 30-year-old woman is brought to the emergency department by her neighbors after swallowing 34 tablets of paracetamol. On arrival, her heart rate is 120 beats per minute has increased. Her blood pressure is 110/80 mm of mercury, and respiratory rate is 20 breaths per minute. The most important initial management step is to, the answer is B, administration of any acetyl system. This is the right antidote for paracetamol. I think this woman was trying to kill herself. Question number 43. You're on the day team call at the emergency department, and a 23-year-old lady presents with a history of low abdominal pain, abnormal vaginal discharge, dyspareunia, fever, nausea, and vomiting for 5 days. The most likely diagnosis is, the answer is D, pelvic inflammatory disease. As you can see, the woman, 23 years old, this age is more suggestive. Low abdominal pain, discharge, dyspareunia. Question number 44. A 20-year-old man presents to the emergency department after being stung by a bee. His skin is red and covered with welts. He has obvious swelling in his lips and tongue, but no wheezes. After treatment with appropriate medications, he complains of throat swelling, and his voice is hoarse. He has stridor inspiration, but a normal respiratory rate and oxygen saturation. What is the most appropriate management of this patient airway? What will you do to the airway? The answer is B. Call anesthesia and prepare for RSI. That stands for rapid sequence intubation. So this patient has to be intubated rapidly to save the patient from from overswelling of the throat due to this condition. So the patient will be intubated by the anesthesiologist. Question number 45. Your brother is 48 years of age. He comes at emergency department presenting with chest pain. In the initial evaluation of this patient, which of the following is the most important diagnostic test? The answer is B, ECG. As you can see, the rest of the given answer don't match. At least ECG match in this question. Question number 46. A 17-year-old adolescent boy who is a type 1 diabetes is brought in by his parents with concern about diabetic ketoacidosis. He has had several prior episodes of DKA. Which of the following is the diagnostic of DKA? The answer is C. DKA is associated with hyperglycemia, ketosis, metabolic acidosis, because the patient is metabolizing fats, and at the end the patient produces ketone bodies. Question number 47. You are attending a 32-year-old woman at emergency department who is noted to have persistent hypotension from suspected toxic shock syndrome despite 6 liters of normal saline given intravenously. Which of the following is the best next step? The answer is B. Initiate norepinephrine infusion. If the patient is having toxic shock syndrome and you have done everything, you have administered the fluid, if fluid can't save him or her, it means that you need to enhance the heart and the body to fight on its own by administering norepinephrine. These are hormones produced by the adrenal gland, epinephrine and norepinephrine. So you initiate norepinephrine infusion. Question number 48. A 20-year-old man involved in a motor vehicle accident is brought into resuscitation room having lost much blood at the accident scene. His initial blood pressure is 80/40 mm of mercury, that is hypotension, and heart rate is 130 beats per minute. He is given 3 liters of normal saline intravenous and is still hypotensive. Which state of this statement most accurately describes the pathophysiology of his condition? The answer is A. Insufficient cardiac preload, because there is no enough fluid in the system, in the circulation system, hence there will be insufficient preload. That's why even the pressure goes down because of hypotension. But other points they are not accurate. Question number 49. A 73-year-old man had a cardiac arrest while being attended at emergency department. The reason was pulseless electrical activity. Cardiopulmonary resuscitation (CPR) was started at a rate of 30 chest compression to 2 ventilation. What is the correct rate of chest compressions? The answer is C. Usually the rate of compression per minute should be between 100 to 120 per minute. Question number 50. A 35-year-old woman presents to the emergency department complaining of feeling lightheadedness, and she notes some vaginal bleeding area in the day. Her blood pressure is 85/53 hypertension. Her heart rate is 130 beats per minute and respiratory rate is 18 breaths per minute. Which of the following is the most appropriate next step in management? The answer is C. Obtain immediate IV access and begin fluid resuscitation because this patient has hypertension and has lost blood. Subscribe, hit the bell sign, like and share my video. It's me, Golfey Oscar, on Brilliant East. You're warmly welcome.